Here, Anna. I want to introduce you to my audience on Facebook and just let everybody know how amazing you are and what great stuff you have to share with everybody. So this is my friend Anna, Dr. Anna Cabeca. She is an OBGYN board certified, and she took a turn for the better, I would say, over a decade, 2 decades ago, where she saw that there was more to OBGYN and being a doctor than what she was taught in medical school. And what's happened as a result is she has turned into really a functional medicine doctor who really knows her stuff and specializes obviously in female stuff, although she can handle anything because she's so brilliant. But because of our background as an OBGYN, that would lend herself to really knowing how to help people get their hormones in balance. And it's we're here today to talk about, like she likes to talk about the juicy parts, getting your lady parts to feel good, look good, and, just function properly. Because so many times you see it too. We see people in the states of adrenal fatigue and exhaustion and hormone imbalance, and they have no libido and they just have no interest in those parts. And we're just going to hear and have a little chat about it, and you can listen in. So welcome.
Thank you so much. It is great to be here with you as always. Who yourself, I admire you. I always tell my listeners when I interview you is that you are the first easing that I followed. I was stalking you for at least over a decade now. I mean, you were my first one. It's over probably 15 years. Rita Marie, how long have you been online?
Well,
and you've been sending out your easing?
I think probably since 2006, probably 2006. Yeah. So
that makes
11
sense.
years. Yeah. And back in the infancy stages of the internet, when your inbox wasn't flooded with health newsletters, and we were just starting to do that kind of stuff. Yeah.
A pioneer in the field. So, and a dear friend. Thank you for having me on. And again, passionate co-patriots and patriotism and passion about getting this information out to people so they can turn their life around.
Right. So tell us more, tell us, kind of what's the link and how do people who, conventionally just looked at, you go to the gynecologist every year, you get the pap smear, they tell you, oh, you're drying up because you're in menopause. It's only natural. Here's some, and they don't really look at root cause, and they don't, what do we do? Talk to us about some of the options that are available for women as they approach that menopausal and even preparing to approach those menopausal times.
Yeah, absolutely. And I would say I started my medical career in 1991. So things have really shifted over. How many years is that? That's a lot of years.
26 years. Yeah. And that's about when I started my practice as well. So we're compatriots there. You were a year before me.
Yeah. And so, but what I've seen over the decades too, is these problems getting younger and younger and younger. The hormone imbalance and the dysfunction and the metabolism problems and the rapid aging. And there's so much to it, especially when it comes to our lady bits, right? And the way medicine has changed or has gotten so limited. Your GYN has 5 to 10 minutes to spend with you, and any more than that, they're losing money, staff, and everything else. I mean, it's ridiculous. It's unfortunate. So if you definitely have a GYN that's spending more time than 5 minutes with you, consider yourself among the blessed, right?
Right.
And seriously, what do they say? They say an average intercourse takes 11 minutes.
Woohoo!
So the average time, wham, bam, thank you, ma'am. I mean, even less, but, the average intimate exposure is 11 minutes, and our GYN exposures are even less than that. And it's hard to really know a client. And when, converging, I was in solo practice. So for so many years, and I was National Health Service Corps scholar. So I came to Southeast Georgia to really address a huge deficit in women's health, for sure, as an OBGYN and a Spanish-speaking OBGYN as well. And what I learned in this solo practice is, again, you've got to get it right? And then you're the only doctor. So if they're not getting it right from you the first time and they're coming back, you have to think, well, what's going on? So I attribute my, accelerated expertise because I was the end all be all for so many of these clients, and I wanted to find out why. Why are they experiencing? Why isn't this conventional treatment working or really getting out the problem? And then after spending years doing hysterectomies and bladder procedures and treating women for vaginal problems, pains, dysplasias, all those things, I say, well, what's causing it, and how can we, first I was like, how can I get a better surgical result, to be honest, right? And so I started using vaginal hormones to get better, healthier tissue to operate with. So I'd get better, healthier result after the fact. And then lo and behold, my clients would come back for their pre-op and would not have the symptom that I was about to operate on them for, right? That was gone. And so ethically, of course, I could not operate. And so, I mean, that's part of the expertise I got with using bioidentical hormones and vaginal hormones. And that's what I teach physicians and train physicians in around the world. And so having that exposure to the clients over years and years and years, and getting to the underlying issues and resolving and seeing those problems resolve, where they didn't end up going down the route of hysterectomy or didn't end up going down the route of bladder surgery, and then the issues with vaginal dryness. And we can hit on that specifically too, because it's a problem that we don't talk about, right?
Right. Well, it's embarrassing to talk about, right? So
yeah, because you want to say and then sometimes we're made to believe or think that it's relational, and that's not it at all, right? Well, then the relationship isn't satisfying, and also we have the issue of the men getting Viagra over the past 3 decades, right? So men can get Viagra, and what happens to us? So our 50, 60-year-old spouse is getting Viagra, and we have vaginal atrophy. So what happens? We go into the office. What can help me? And it's vaginal estrogen. Well, vaginal estrogen really doesn't improve elasticity and the deeper tissue of the vagina. It helps with moisture, certainly, but not like vaginal androgens do, or using androgen therapy like testosterone. And you mentioned adrenals, DHEA, a huge important adrenal hormone that will convert down the line to testosterone. Those can affect the muscle, and that really rejuvenates and anti-ages the vulva and the vagina, and that can make a big difference. So, and that helps, because also add a little bit more of the androgens in, a little bit more of the libido can come back, and satisfaction and pleasure, we can feel that pleasure again. Another thing that women don't talk about, and again, I'm over 50, right? So I talk and I know these issues. I was diagnosed with premature ovarian failure when I was 30, or premature menopause when I was 39 years old. So I know what I've experienced, these things through professionally and personally. Rita Marie, you and I know this on an intimate level, and now I just shared it on Facebook Live.
There you go. Everybody now knows that.
So, but that issue of vaginal dryness is one aspect, right? But what is the irritation or the urinary infection afterwards, the vaginal discomfort afterwards, and that can be a very negative feedback to the whole purpose of wanting to have sex to begin with. If you have discomfort, pain, irritation after the fact.
During, hurts after, why bother? And so the libido is going to just naturally fade away.
And it's not a conscious fading of the libido. It's like your body hurts, don't do it. On a subconscious level, because you may love your husband, you may love your partner, may love having sex, but you're like, well, why don't I ever want to have it anymore?
Right. Right. Wow. You touched on something that I hear a lot, not just in perimenopausal women, but all ages, is getting bladder infections after intercourse. Yes. So I want to hear more about that. What do you think the root cause of that is?
It's definitely the introduction of bacteria into the urethra, especially as we're getting older. Well, there's always, even the term honeymoonitis. Have you ever heard the term honeymoonitis?
Honeymoonitis.
Yeah, honeymoonitis. So that is with a bacterial vaginosis infection at the same time as a bladder infection. We always term that honeymoonitis. And that is because alkaline sperm, right? The alkalinity of the sperm creates an overgrowth, more of an alkaline vagina. Our vaginal pH is really very acidic, and on a cellular level, very acidic. So that now this alkaline semen comes in, and the bacteria overgrows and just loves it. And unfortunately, there's a fishy odor that's often associated with that in growth, right? Then
Yeah.
the amines from the semen, etc. And then from the frequent intercourse, right? Honeymoonitis, frequent intercourse, you can get that introduction of bacteria into the urethra, and it's not expelled as easily. As we get older, it's because the tissue also doesn't have the natural lubricant and the healthy, normal flora that's associated with a healthy vaginal tissue. And you can get more urinary tract infections. And any woman that's had more than 1 to 2 urinary infections a year, I always put them on prophylactic vitamin C, not antibiotics. If you're on prophylactic antibiotics for a urinary infection, you're doing more harm than good. I want to say that again because it's so important.
Yes. I think it's super important.
Super important. And if you're on prophylactic antibiotics, daily antibiotics for urinary tract infections, you are doing more harm than good. So what we can do instead is probiotic. We can do vitamin C 4,000 milligrams a day. And you can also urinating after intercourse and making sure that you're drinking plenty of water, and then reviving, using anti-aging, topical anti-aging formula like Julva, of course, to help that tissue get really healthy.
Yeah. So I'm gonna welcome some people who've joined, and Meg, who is a very good friend of mine from up in the Northwest, and she's a chiropractor and very interested. And she said she's watching from her vacation on the beach. So I just thought that was fun to see. And Margie, welcome, and Keldy and Lynn, and who else is here? Jodian. So welcome everybody, really thank you. And if you have questions or comments, things you want us to cover, just type them into the chat and we'll make sure that we incorporate, because we want this to be living. We want this to be useful. We don't want this to be just a fun theoretical discussion between two friends and colleagues that doesn't really help anybody. Our goal is to help. And the interesting thing you just said, right, because of the honeymoon, the cystitis that happens in women, and a lot of people say that they don't like to have sex because they get a bladder infection after. And what you're saying is it's not necessarily that we're introducing bacteria from the partner. It's that we've already got that bacteria, and the interaction with the partner is causing it to shift from vaginally into the urethra. Did I understand that correctly?
Yeah, absolutely.
Yeah. Because a lot of times we're like blaming the partner, right? It's like, he must be infected somehow and he's infecting me, but really it's not. It's really that you're infected and you need to deal with it. So you mentioned topical rejuvenation. Tell us more about that. We do that for our skin and our hair. Tell us how we do it for the lady parts.
Right. And that's something we, realize our facial wrinkles bother us. But we don't think about what's happening down there to our delicate feminine bits, right? Our lady bit parts. And as we lose the elasticity, just like we do in our face, on our hands, we lose elasticity down there. But what does that cause? That can relate to prolapse, that can relate to incontinence, that can relate to, less sexual satisfaction, less blood supply, less healthy vaginal tissue. And all that can have an effect. Being atrophic around the vulvar regions. And so as a gynecologist, and again, sexual health, expert in this field, I looked for solutions on how I can help. And that's how I became an expert in bioidentical hormones for sexual health, and using it topically to the vulva or vaginally by prescriptions. Testosterone vaginally is only available by prescription, and can help. A little bit goes a long way, y'all. 1 milligram, 2 milligrams. I mean, that can go a long way. And DHEA as well. There's now vaginal prescription DHEA available. DHEA vaginally is only available by prescription. And then they can also combine that with testosterone or some other bioidentical hormones as well. And that can make a difference in revitalizing. So what I found when I retired my clinical practice 3 years ago, that clients are like, okay, well, what can we use? You're not prescribing. And so I've spent the last 4 years, actually, because I had created something beforehand to use topically for the vulva, and that's Julva. I'll show you. This is Julva, anti-aging cream for the vulva. Beautiful little pocket here.
Right?
We need it. So, again, anti-aging ingredients that are so important for keeping this area healthy, so that we're not dealing with these problems, or if we are, to try to, revitalize that special area.
Right, right. And so how do people use that? What's the best,
So
and what can it be used for besides, the obvious, the atrophy and vaginal pain on intercourse?
so so this is for discomfort, definitely because of dryness issues and irritation issues. Certainly, like a good anti-ager, it's going to help to restore that. So clients can come in and they can be complaining of leaking when they cough and sneeze, just because they've, the wrinkling, the folds, the changes in those tissues, and they need more intense moisturizer, they need some additional support, and adding that in can make a big difference. But a little bit, an eighth of a teaspoon, or about actually less than an eighth of a teaspoon, a half an ml, applied from the clitoris all the way down to the anus, keep that tissue healthy, is important. Women deal with anal problems too. I mean, we're talking about this on Facebook Live. No one wants to type in now after hearing me talk, right? but so can deal with all. I mean, people have had hemorrhoids, we've had children. The changes that occur, just that loss of elasticity that can occur, and other reasons that we have loosening of that tissue, wrinkling of that tissue, loss of elasticity of that tissue, that we want to really improve that and give nutrients back. Just like a healthy diet with healthy fats and oils are so important, we need to add that directly to the skin. And oral hormones just don't work on that area like we need. We know that oral estrogen can actually sometimes worsen the problems of incontinence, and may not affect that vulvar vaginal tissue at all.
And so is this also something that can be applied intravaginally, or does it work on the actual inside?
So this is where it gets tricky, Rita Marie. So this is a topical cream. It's a cosmetic formula, anti-aging, moisturizing, luscious, yummy formula that has incredible ingredients in it to help with so many things. It is pH balanced for this area, and it is safe enough to eat. It's really natural ingredients. That's so important. I always say your cosmetics need to be safe enough to eat.
Exactly.
So this can be applied anywhere, around the eyes, under the neck. It can be, but it's specifically formulated for the vulvar area. It is not a big deal if it gets inserted during intercourse, because women and men like to use it to help moisten the sexual experience as well, and that's been fine. I hear so many great feedback for that as well. So perfectly safe.
And it's not a hormone
design,
right?
It's not a prescription hormonal cream. It's topical, and it's for external use. And it has alpine rose plant stem cells in it. So the alpine rose is this really cool. Rita Marie, I love this. It is the rose that grows in the Swiss Alps, and those harsh conditions of ice and everything, and yet it blooms. And so the scientists studied the stem cells from the alpine rose and found it to have tremendous anti-aging properties. So it's being used in some really high-end cosmetics, anti-wrinkle cream, and all this good stuff. And so I was like, oh yes, when I was looking to compile, better ingredients than what I could technically write for, I looked at the alpine rose plant stem cells, and I added that in there. I added coconut oil and emu oil and some shea butter, really good nourishing ingredients, and DHEA, which is a adrenal hormone, and that is fantastic. Combination.
Yeah, great. So for me, what this feels like is, before, yes, you get great results with having prescription DHEA, testosterone, et cetera, like you said, but you have to get a doctor that's willing to prescribe it. And a lot of just conventional medical doctors, where you go into, your HMO and you have your 5-minute appointment, they don't know anything about this. And so they don't know to prescribe those sorts of things. Plus, it's probably more expensive, more inconvenient. You have to, keep getting it refilled. So this seems like it's an option for the average person to just buy some cream and keep that area in good health.
And it's an option where none have existed. This is my whole thing. I've been trying to create solutions for women naturally that we can use, that I can use, that, that will make life better, that I could use for my clients and patients and women who are suffering. And we know that the ingredients in my combination are safe in clients who have had breast cancer, for instance, and can be beneficial in clients that have had no hormone therapy because they had history of blood clots. DHEA topically, and this combination, DHEA topically has never been associated with increasing coagulopathy. So here they're the excluded people that are left to suffer, right? I mean, that's it, left to suffer. I mean, and that will include a majority of us in menopause, where we're left to suffer because, we don't have solutions. And as GYNs, it's really hard to get to the underlying issue and the way our practice is. But I have several GYN offices that are recommending Julva. Again, it's been around since October. Word of mouth, it's spreading. Many physicians are loving the results clients are getting with it, because again, many physicians too, I mean, we have our specialties, but we haven't heard of these therapies. It's not yet taught in medical schools.
Right. As is a lot of the stuff that we talk to people about.
Yeah, it's experience and expertise, right?
So some new people came on. Michelle Gamble wants to know, where do you get it?
Julva.com.
Oh, wow. That's easy.
Easy.
Julva.com. Awesome.
Julva, remember, joyful vulva. Shortened to Julva.
I love it. Oh, and we just put in, one of my team members just put in the link in the chat. And Kelty wants to know, so does the loss of tissue in the vaginal and anal area increase the chance of hemorrhoids? Will Julva help with the recovery from hemorrhoids? I've most recently had this conversation with a girlfriend. You're the universe is the answer to our discussion. So timely.
Wow, that is timely. So the goal is that it's going to help improve, right, anti-aging to this area of the vulva and all the way down. I encourage women to use it all the way down to the anus, because I remember doing hysterectomies and hemorrhoidectomies at the same time, and the patient would have a much harder time recovering from the hemorrhoidectomy than the hysterectomy. I mean, it is a painful problem, but the idea is that we've lost this elasticity, and it could be because we've struggled with constipation issues, and then again, just as we age, it's something that we're supposed to use preparation H for, but there are better answers, right? Or have surgery for, and there were better answers. So definitely, especially if we're dealing with hemorrhoids, it's probiotics, it's water, it's exercise, it's, really getting your pH, urinary pH alkaline, and, good healthy fats in your diet, and all those good things to have regular, good, healthy bowel function. And when I lecture, this is, Rita Marie, when I lecture, and I always say, I'm a gynecologist, I can tell a lot about a person's health from the vagina, right? That is, a window, honestly, to the health. If we're having infections, if we have irritation, if there's redness, if there's paleness, if there's loss of sensation, we can look, okay, well, where is there the bigger problem coming from? And that's the type of thinking that, I really want us to get into as physicians, as clients, like, well, this is the symptom, what was the cause, and how can I go to the tiniest cellular level to affect that cause? And it's never like 10%. Julva's 10% of the answer, right? 90% is in lifestyle and therapeutic changes.
Right. But it's that last thing, we see a lot of them, I'm sure you do, doing it right, where they're drinking plenty of water, they're taking their probiotics, and there's still that need for a little bit more. And sometimes it could be that you're doing everything right now at this point in time. But what about the 50 years that led up to this point in time that caused a lot of imbalances? It's going to take a while for it to correct. And why not go in and have something that you can do symptoms? I always talk about go to the root cause, but darn, I'm going to give you some symptom relief while we're going to the root cause.
Address it from both ends, always, right? From both ends, from the underlying cause to let's get rid of the discomfort.
As long as it's a safe, natural way to get rid of it. Because some of the stuff that the pharmaceuticals are putting out, I'd rather live with the symptoms than the side effects.
Well, I had a 35-year-old client. I was in Barcelona this last month, right? And I got to lecture for an anti-aging medical association for Spain. And yet I was part of Mind Valley University program, had attended there. And one of the attendee parent also was, we were having this discussion, and recently prescribed an anticholinergic, right? Like Detrol LA for urgency symptoms. She goes, I figure it's hormonal or whatever it is, but just I have to go. And I'm like, oh, a lot of times that's, again, let's revive that tissue. Let's get the moisture back. Let's improve the pH balance. Let's do these things. And lo and behold, I mean, within a week, she used Julva every day. And within a week, her symptoms were gone. Wow. And so that's just a blessing. I think like a divine encounter there to be able to alleviate these problems and symptoms versus taking a medication that makes you more vaginally dry eyes, dry mouth, and dry vagina. I mean, but I'm not leaking or having the urgency symptoms as much, but we never address the root cause per se. And again, sometimes we need this. I prescribed it, right? And I've operated, and there's many things that we can do naturally that are better answers, or at least first answers.
Right. And sometimes there's having to do both. And
yes,
what my big problem is the medical intervention that precludes any natural intervention. So yeah, sometimes you may need it. The thing's gone too far. You've got to do a tuck or whatever you have to do to pull something up. But you can't just do that and expect, if you leave the same conditions there that caused it, that it won't come back again. So I just love that you've taken your allopathic medical training and turned it into something that can actually help people to heal and feel comfortable and feel better. And I believe that just that emotional well-being of feeling better is going to aid in the well-being of the rest of the body and correcting all those imbalances.
Absolutely. I would say, like, get back into our feminine sexy no matter what our age is, right? Because we can tend to lose that too. And we don't want to lose it prematurely. And I want clients to know that, that there are these effects that we're associating with natural aging sometimes aren't. Consider tampons, pads that we've been using with harsh chemicals on them, right? Or that have GMO, and consider the endocrine disruptors that we're putting on our body and our skin, from our shampoos to our body wash and soaps, and those things are going to affect your hormone balance. And absolutely. I see things like lichen sclerosis at a higher frequency than I used to see it, and I have to wonder. I don't know at all. I'm not saying that there is an association, but between the how many thousands of chemicals that have been introduced without long-term studies, if that's not affecting us. Yeah. And so permission to go commando to anyone who's listening.
Well, you just have to look at what are the possible causes. We're not blaming anything, but think about it. You mentioned some things that are controllable, and you can switch over and you can dump the old chemical laden cosmetics and shampoos and hair stuff and all. But there's certain things we can't control. Right? The outgassing from the carpeting in our house. Well, we could do something about it, but then what's the alternative? There's no phenomenal alternative. So indoor air pollutants are endocrine disruptors. The water bottles, we travel, we don't want to drink. You have to choice between drinking filtered water out of a plastic bottle or drinking tap water that has who knows what and whose prescription medications floating around in it. And we always have to make choices. So when we have to make choices, and we can't be perfect and pristine like we're living up at the top of the Himalayan mountains like a monk, then we need to do some things to intervene. Because a lot of people say that kind of thing to me. Well, you're so into natural and food and all. I said, yes, I am. But there's also a lot of unnatural around that I can't control. And so I'm going to use supplements or herbs or topicals, creams or whatever to help restore my balance. And that doesn't mean I don't totally believe in the innate ability of the human body to heal. But sometimes there's a point of no return, and sometimes you just can't control.
Well, and there's the layering effect, right? Like, how much has this been layered on us, right? It's like things we can't control. I mean, I just flew in airplanes from one place to the next place. Right. When you go into an airplane, you're exposed to tons of toxic disinfectants that have just been used, and then it just goes on from there, or hotels or conference centers or
sleeping on. Who knows what kind of stuff is in that stuff. And we're exposing ourselves. So I really love having something that can help counterbalance that. And yes, I wish we could all just live in this beautiful, pristine, perfect, utopian environment where we're not exposed to chemicals, we're not exposed to stress, we're not having to listen to the news, even if we try not to, and get ourselves stressed out, and then just live happily ever after and not need anything except what we pick. to take from nature, right? That's the
Absolutely.
pristine ideal world we both want. But unfortunately, we can get close, but we can't quite get there. So I'm just really excited by what you're doing. I know Mighty Maca was your first product that you formulated, and I absolutely love it. And my people actually absolutely love it because it's this combination of all these great herbs plus maca plus all the greens. And it's just a wonderful adjunct to your daily life. And when you told me you were formulating this, I was like, okay, this is cool. And I wanted to talk to people more about it and share it. And I'm hoping that Dr. Anna gets to be coming to our Shine conference, which is, it's November 3rd to 5th. You will be getting an announcement of it soon. We're working on it. We're working on finalizing, hopefully, her schedule to work to come and speak. And the conference is all about food as medicine. So food as medicine, that food is everything we take in, put on our bodies, but also everything we put in our ears and the, the surrounding energies that we surround. So I think about nourishment as everything that we put in our body that interacts.
And you said, what comes in our ears and the thoughts we create ourselves, I mean, really the self-talk and women, we're really bad about it. Like we will, be critical of ourselves more than we would be critical of anyone else. And that just has to stop. We have to focus on the positive continuously and in discernment, what was good about today, what was good about my life, where can I, where do I shine? Where do I see love? Where do I feel love? Where can I be more loving in a very positive, non-critical way, and really create that aspect, especially as we're, going through, like I said, I'm 51 this month. Happened very quickly.
How could we look so good and be so up there in age, right?
The butterfly, right? We come in the butterfly and coming into our own. And believe me, I can, cycle back and think my mom had her first cardiac bypass surgery at 52 years old. She was under the knife at 52 years old. At 67, she passed away. She dealt with diabetes from her late 30s on. By the time she passed away, she was on 11 medication prescription drugs. I wish I knew then what I know now. And that's why I'm so passionate about everyone who's listening. We have to have the discipline and the practices of the right next steps for our life so that we can blossom. I don't care if I don't live past 67, but I don't want to live sickly. I want to have the quality of life that, God has divined in us to have and live that to the best of my ability anyway, to the best of my ability and to pass that on to my family.
Absolutely. I totally love that. I love that. And if, I think that the way that our lifespan should go rather than the way it is we're like, okay, we're healthy, we're getting bigger. And then we start to go downhill and fade away. And I think we should be happy, healthy, dead. That's just the way it should go. We shouldn't have to live in that despair as the body, destroys itself basically.
And if you have a diagnosis, don't give up. Like if you have diabetes, even, my father with kidney failure, he passed away at 91, but he was, technically after your 70s, you have 6 months to live once you go on dialysis. Dad was 89 when he started dialysis and went to 91, again. And he did a large part of that with a really high quality and high mental function. When he was, sick and infected and feverish, lost the mental function, but we regained it as we corrected those issues. And that's sometimes where it's lost, thinking, oh, well, this is how it's just going to be. No, you can reverse it.
I totally agree with you. So a couple of things. Michelle is one of our practitioners, and she wants to know if you have an affiliate program, so we can send her your way for that. And if anybody else is a practitioner, this is a great adjunct to what you're doing and a great way to support people with these kind of issues. Carol wants to know, hi, Carol, do you have any help for uterine prolapse?
So uterine prolapse is difficult because you've got a relaxation of the uterosacral ligaments. One thing is getting some, trying, especially if you're thinking surgery for uterine prolapse or pessary use, you want to get some good vaginal androgen. So have your doctor prescribe some vaginal testosterone and DHEA combination in order to really, at least if, to see if that can improve. Doing pelvic floor exercises and making sure. Prolapse sometimes is because of intra-abdominal pressure. So if there's SIBO, if there's increased gas or any intestinal issues going on, that can cause an increase in intra-abdominal pressure, and that's going to push up, it's going to push down, right? That makes sense. That's the mechanical part of extra pressure on weakened muscles. So you definitely want to work back and strengthen those too. I have a great video on my website about the, quick and easy and right way to do pelvic floor exercises or Kegel exercises. So check that one out too.
Wonderful. Thank you for that. I love what Keldy said. I love this conversation, open and truthful. These are the discussions I love. Talking about sex with no shame. You ladies rock. Yay. Karen says, so happy to be here. You are both my teachers. Marcia May. Hi. Elaine Watkins, Antoinette St. Clair, Tony. Okay, here's one. What's the best natural solution? This is from Keldy again. When you end up with a bacterial overgrowth, is that vitamin C? I've heard about some people using acidophilus.
Bladder or vaginal? Is that for bladder?
I think she meant the vaginal, but Keldy, yeah, you can type in. So we can talk about both because probably there are people that want to know about both.
So definitely with bladder, I mean, sometimes you have to have antibiotics, right? But treat it for the short, the full course of that therapy. But then to prevent it from coming back, you want to do the vitamin C, 4,000 milligrams. You want to do a good probiotic. You probably will recommend some. I use ProBioMax from Zymogen, and that's an excellent formula.
Doing it up.
You can take it orally.
Yeah.
But you can also use probiotic vaginally. Absolutely. Yeah. And there are certain formulations that are specifically for vaginal, but lactobacillus is fine as well.
Okay, great. Yeah, because I know that for bladder infections, I've had really good results with certain over-the-counters. Like Thorne has a product called Uristatin that works phenomenally, that people don't need to take the antibiotics. But there's times when you do need to intervene if it's not going away, and then, it goes away. And I've had one bladder infection in my whole life. And I remember taking that and it went, and the vitamin C, the high dose vitamin C, and it went away. So I stopped taking it and I was really focusing on my water. And then I was like getting ready for Christmas and doing all this other stuff and stopped. So what you just said about taking a full course, not just with the prescription antibiotics, but with the herbal things as well. It should be a full course of 7 to 10 days. Even after the symptoms go away, you still continue to drink tons of water, take the vitamin C and take the herbs. Otherwise, it will come back because you just got rid of some of the weaker organisms and the strong ones are going to take hold.
Right.
Yeah.
Right. Absolutely.
So then vaginal bacterial infection overgrowth, what are some of your things there?
So definitely it's about getting your, the vaginal pH is acidic, but you want your cellular pH to be alkaline. And that's just going to say a good turnover, less inflammation. And so one thing is, when you have a bacterial, it's miserable, right? There's that fishy odor. It can be very uncomfortable as well. Like if you've ever had a bladder infection, a vaginal infection is no fun either, right? Yeast infection vaginally, bacterial infection bladder, it can ruin your day. I mean, seriously. And so, so a couple things to do there is if you need to, I never recommend douching. For those people that douche regularly, there's no indication to do that. But if in this case where you have a strong bacterial vaginosis or bacterial overgrowth, vaginally you can do a vinegar and water douche, and that would be the only kind that I would recommend it, just to kind of flush and get a little of a leg up on what's going on there. You can use a vaginal probiotic. They're really key. You work on a very good alkalinizing diet, healthy fats like avocados, salmon, oysters. Good alkalinizing, keto alkaline food choices that, I'm really big on. And so that can make a big difference. Your vaginal health is a reflection of intestinal health, and that, that's an issue. So you want to do, maybe even if it's a recurring issue, is do, a good detox with a 72-hour protein shake or, fast, so you can get that 72 hours for the intestinal lining to regenerate, right, to turn over. And so we need that 72 hours of good GI rest with good nutrients on board. Never a juice fast without protein on board. And I think that's really important from my standpoint with hormone balancing. That makes a big difference between a healthy detox and an unhealthy detox.
So you're saying like a juice, if you're doing juice, to put some protein powder, like tell them about a little bit about your keto alkaline concept and where that came from, because it's very unique. And I really enjoy your keto alkaline protein shake.
Thank you.
It's low glycemic. There's no carbohydrate in it. It's got good protein, good fats, and it tastes pretty okay compared to most of them. Yeah.
Yeah. Can add some Mighty Maca in there and it tastes awesome.
There you go.
And so one thing is, so what I recognized is that ketogenic diets, I've been looking at the research for quite a long time, that works for cognitive function, supposed to work for weight loss and all this stuff, but I could never recommend the low carbohydrate diets because myself particularly would go a little wacky, and I called it keto crazy, right? Like I just would be on edge, I'd be more agitated, not feeling as great initially in the ketogenic stage. I'm like, well, what's going on? And I would I'd been doing alkaline detox programs for over a decade, right? For decades then. And I said, well, what's happening? So I started checking my urine. That's why I created these urine test strips that measure pH and measure ketones, because I started checking my urine for pH. I was acidic. And I'm like, what if I get alkaline? And so I started getting alkaline and then got into ketosis, and I call it like ketones on urine test strips turn red, alkalinity on urine test strips turn green. And so it's like Christmas, red and green, and it feels amazing. It was energy galore. I was able to drop weight, feel good, have that higher clarity and spiritual clarity for me, which is really important. I don't want brain fog. I want connection, and I want clarity, and I want to be able to discern rightly. And those aspects are important. So I combined that. And also my father at the time, I put him on this program, really working with him on that. And then from there, I did a test group of 8 menopausal women, some of the hardest patients that I've ever known. And like, let's see if this works for me. Does it work for you? So that was a couple years ago now. And certainly it did. And that's how my Magic Menopause program, keto alkaline is for anyone, and it really has good results, but ketogenic diets may work better for some than others, but it really depends. If you're not testing your urine to see if you're alkaline, that's gonna be a big factor. Yes, ladies, and when your husband does it with you, they get alkaline faster and they get keto faster. It's just not fair, but that's how that's the design. By design, it's pretty interesting.
So I'm just curious if you could share a few tips. I know you have the whole program on it, of how somebody gets alkaline while doing keto, because keto is by, the typical design is just there's lots of meat, there's lots of very acidic forming foods. And what do you do to shift that towards alkaline?
Yeah, and I think that's a huge component, because like any diet, it is not, any lasting weight loss program is not only about what we eat and about how much we move, right? Diet and exercise, maybe each 25% of the picture. There are other issues that affect our alkalinity. Stress being a huge one. Yes. Being indoor, living, under and exposed to EMFs. Right. It's a big one that's going to create acidity. And so when we are more by design out in nature, less stressed, going for long walks with people we love in social situations that are safe and comfortable, and we feel that connection, we have security, right? Those are things that are going to help us be more alkaline. And I go through that because nutrition is certainly part of it, but it's like the keto alkaline plate has a lot of greens on it, spinach, beet greens, and good vegetables. Maca, Mighty Maca is a big part of that, because maca is very alkalinizing, and then add in some natural inflammatory fighters, right, that are going to help too. And I think that makes a big difference, makes it easier. And then water, hydrating, making sure you're really well hydrated. And also, again, positive thinking, self-talk, those are big issues, but definitely adding more greens. And that has to be, that's part of it, but it's not the only part of it.
That's awesome.
And I had a client that was having so much trouble getting alkaline, and she was juicing, and then recognized that, oh my gosh, like when she calculated out the amount of carbs in her juice, it was, was counteracting any of the alkalinizing benefit because her glucose was going up.
Yep. That's
and her hemoglobin A1C was 6.0. So we really figured that one out.
Yeah. Great. Let's see who else has a question. Doreen says, fabulous conversation. As women, we tend to shy away from these kind of conversations. And thank you for bringing it to the forefront. And right here on Facebook Live for the world to hear us talking about vaginas and sex and all that kind of stuff. Okay, we have that.
Till we get banned on Facebook.
Till we get banned, I know. We have to be careful what we call it, right? There we go.
But it is. You're right, Doreen. It's so important. And it is something that, we need to have conversation around, because pushing it under the rug, like any issue in a relationship, doesn't get us anywhere.
No, it doesn't. And Kelly says, this is so helpful. Thank you. In the past, my GP just prescribed antibiotics, and addressing the gut sounds better to me now that I've learned so much from Dr. Rita Marie and her guests like you. Thank you. And this is a question, I don't know, Nasma asked. It's the best way to approach hormone imbalance. And I would probably want to ask, which hormone are you talking about? Because there's so many hormones and they all interact with each other. Like to say there's no one approach to hormone imbalance. Well, you've already said it, getting alkaline and eating lots of greens and getting the diet in order and good fats in the diet and the basic, de-stress and exercise and all the basic foundations are important to address hormone balance. And that's where I like to start. And it's like, if we get all those things in place and there's still imbalances in the hormones, then we're going to address it with herbs, with nutrients, with topicals like Julva. Your opinion there?
Yeah, absolutely. Exactly correct. That's the first steps.
Yeah.
Really. And that will make a big difference because you'll feel better. You'll have clarity. You'll be able to do the next steps.
And Nasma says adrenal fatigue and low cortisol.
Adrenal fatigue and low cortisol. So I would start with Mighty Maca and getting a good night's sleep. Those two things. Really, when you have to reset your circadian rhythm, and that becomes a challenge. So you really create a lifestyle, heart math, to get into coherence. That can so help adrenal issues. That can so help. And I don't know what you're dealing with, but a guy struggled with PTSD. I mean, I was a flatlined adrenal client, right? I had no DHEA, no cortisol.
Yeah.
And so those were some of the, issues that I faced, and getting, really working on coherence, on balancing alkalinity and resetting my circadian pattern. I mean, it's a constant discipline and practice.
Right. Totally. And I love your story was you were told you were in premature failure and you would never have any more kids, and you were in this horrible state, and you took control and you de-stressed and you started looking at food and herbs and all that, and you had another baby and completely changed the course of your career. And that was after an extremely stressful situation in life, and way more stressful than anybody here will ever want to go through. So I admire that in you, that you were able to turn an adverse situation around and completely rebuild yourself. And now you're helping, tens of thousands of women to do the same. So my gratitude goes out to you for this. So this has been amazing. I think that we've had a lot of great sharings. Laura said something, right? Great information, loving this Facebook Live. I mean, everybody's really loving it. And if you really are loving it, hit the little heart thing, get some hearts going for Dr.
And share this conversation, because people want to hear it.
Yes.
People need to hear it, whether they want to hear it or not, really.
Whether they want to or not, but they do need to, because it's so important. And again, going back to, I'm just, because this is my big thing, is going back to foundations, what I call it foundations. We have to have the foundational lifestyle diet things in place. And we can look for the fancy herbs and we can look at Julva, but Julva is not going to make up for you eating Twinkies and drinking Diet Coke, right? You've got to change those things as well. And it's a great help for you to get over the hump, but you've still got to do the work. We all have to take control, because we've got this amazing innate inner healer, whatever we want to call it, God, the universe, source, or just our inner healer. I like to call it my inner healer. And my that knows how to get me well. It knows how to mend a bone if I break it. It knows how to heal a cut if I cut it. Why shouldn't it know how to get my hormones balanced, assuming I give it the right environment, right? It can't heal my broken bone if I keep using it. It can't heal the open wound if I keep sticking it in dirty dishwater. So it's the same thing for those internal parts. We have to treat them with love and respect and caring, and then we can treat them from the outside to accelerate the healing.
Yeah, Rita Maria reminded me, I was just on, part of my trip to Europe was a little holy pilgrimage as well. And I thought about how in the Middle Ages, people were kept from learning the knowledge of the Bible, right? It was translated for them. It was interpreted for them. It wasn't accessible for us to study it ourselves. We've done that in medicine. We've said, oh, you can't trust your intuition when it comes to your body. Come to me and let me handle it for you. Or let your insurance, your insurance company has your best interest in heart. I'm here to tell you, listening, it does not. It does not. You have within you the power to be your own doctor and healer. And, the information is available, and go back, get your head clear. Let's detox. Let's get keto alkaline. Let's get clarity so you can discern what is good for you and what is not good for you on the little things and every little step that we do. And wisdom of menopause is there to help you. This shift, neurotransmitters and hormones, there's a benefit to that. There is absolutely a benefit to that when we get clear, when we get our body clear, so our spiritual energy can really get stronger. I think of some of the best spiritual teachers of our time. We're all over 50.
Yep.
I'm there now.
There you go. Hey, you can join the ranks. And I feel like menopause was this transition for me, but it was a beautiful transition. And I feel like I'm more clear, I'm more focused, I'm more in tune, I'm more confident, and I'm able to create more powerful change. So what we have been sharing with you is ways to help you to access that inner healing and accelerate the inner healing. And I think it's super important that you reach out for help, not from a doctor who's going to say, okay, honey, I know what to do. Here's your prescription, just do this. But someone who can give you the guidance to help you facilitate what you really need to be doing.
And it's both, Rita Marie. I know that much access to functional medicine doctors, especially in gynecologists, we're less than 0.001%. So there's a small number of us, right? And so it's taking both, right? I put a ton of information. 90% is therapeutic lifestyle changes. So over 90% really, but I'm a doctor and I want to claim 10%. So I can't let go of that. My ego won't let me, as humble as I try to be. So it's that self-study, the programs that you have, the programs that I have online to really start bringing you that information. And everyone listening can think of one right next step they can take they know that will improve their health right now, and just commit to that one step. By the time you get off this, write that down and commit to that next one right step, because you know it. And then take, doctors, we are burnout in medical practice. We are having to deal with insurance companies telling us how to practice, y'all. It is not the great environment right now. And, where it's an investment is getting concierge medical doctors with functional medicine training, naturopathic doctors, going down that route, ancillary to our standard medical sometimes, because it is a challenge.
It is, yeah. We need to be empowered to take charge and really access that healing. So, thank you so much for being here. A few last comments, just lots of hearts. Let's do more hearts, and definitely share, especially the practitioners. Feel free to share this with your own followings. Elaine says, yay for menopause. And Nasma says, thank you very much. I enjoyed and learned lots of knowledgeable information. God bless. Thank you. And then you had a quiz, because people are wondering, they're always like, where am I at? And how am I going to know if I'm out of balance? So tell us about your quiz.
So the Eve quiz for pelvic health. So you can put that link up if you've got it, Rita Marie, but the Eve quiz, and because we want an inventory, what gets measured gets managed. And I wanted clients coming in, if they're going to start with Julva, it's like, let's do an assessment where you're at now, because 4 weeks from now, 8 weeks from now, I want your number to be better. I want you to have 0 symptoms. I want you to have 0, check boxes. I want you to be feeling really more empowered in your body, but you don't know if you don't measure it now.
Right.
And so the pelvic health, like, am I having pain? And I'm going to ask you questions. I ask you questions in that quiz that you may not have associated with hormone imbalance, or you may not have associated, or you may have thought was just normal aging. Look, y'all, we have, there's nothing normal about incontinence pads. I'm telling you, there's nothing normal about that. And that is just not fair. And so, let's look at where we're at right now. What is the situation specifically as it relates to our intimate health, our relationships? Because many women will believe, again, like we talked about, is that, vaginal dryness, well, maybe I'm just not attracted. It's not that. And true that when you have a new partner, initially you'll be more lubricated. That's just biological. Your body will respond in that way. But then the changes will result back to where you are at the beginning. So let's get to the root cause of these changes now. Does that make sense?
Exactly. It totally makes sense. It totally makes sense. So that is usually very, it's extremely helpful. So we just posted the link. It's drritaMarie.com/go/Eve quiz. Yes. So that'll get you directly to Dr. Anna's quiz, and Nicola will put it in the chat on the Zoom for those of you who couldn't make it to. Oh, there's 20 of you here. Wow, lots of you. And if you have questions here and you're on Zoom, go ahead and type it in and I'll see them and I can ask Dr. Anna, because we're about to wrap up. Here, let me just do this right now. I'm just going to type the link in.
Perfect. A minute. Yeah, so any questions you have too, like if you're on Facebook Live, put them in. Even after the fact, because Rita Marie, I know, is always stalking her Facebook Lives, and I will too.
Yeah, we'll
do what we can. Yeah.
There, I just put both links into there as well. We do this joint. I like to do this joint because some people are just not able to get to Facebook. They don't do Facebook. Some people are in their car and are not so good at using the phone and getting on Zoom while they're driving, so they call in. So it's like this joint dual kind of. Get Dr. Anna all over the place. Yay.
Wow, that is awesome. I got to figure that out. I'll talk to you afterwards on the mechanics of this.
Absolutely. Oh yeah, it's easy. I'll teach you how. A couple of last questions here. Let's see. Pamela Weems just joined. Hi. Meg Simons, thanks for taking a root cause perspective. Yay, Meg. Hi. She's one of my buddies. She and I went to chiropractic school together, many, many decades ago. And she practices up in Seattle. She's an amazing doctor. Elizabeth Rayson, any advice on gallstones? I'm 49 and have a good diet. I'm estrogen dominant. I think I'm estrogen dominant. I think all the same. What do you say?
Yeah, definitely, progesterone is a big natural, again, make sure if you're estrogen dominant, progesterone is key. My progesterone is Pure Balance PPR cream. It has 20 milligrams of progesterone, 10 milligrams of pregnenolone per pump, and can be very beneficial. The other thing is, again, estrogen dominance. And there's something going on in the GI tract because converting a lot of, unhealthy estrogen metabolism from a dysbiosis, most likely. And so I say detox, 21-day detox program. And I offer that on my website too. And I know you do too, Rita Marie, but definitely address the gut when you're estrogen dominant and look to see where those endocrine disruptors are sneaking in, face, cream, makeup, body wash, shampoo. All these things can definitely create that added disruption.
Right. We have a chart that I give in my green cleanse. It's a picture of the body, and it has like links, like pictures, all different places of where the endocrine disruptors are. It's pretty cool. They're coming in, like you said, all over. And like I said earlier, you can't really avoid them all. So it's really a matter of, it's the diet, it's the attitude. And I see a lot of folks with the great diet, but they're pissed off that they're on a great diet. They're pissed off that they can't have their chocolate cake and their pizza. And that's going to be just as disruptive as eating the pizza, right?
I try not to be one of them, Rita Marie. I try.
I just embrace the food and say, I love you, green smoothie. I love you. Yes. It benefits so much. Yeah. So thank you. Enlarged thyroid nodules. Ooh, that's another one. Any thoughts on that? Is You know, there's
I think inflammation, and then again, endocrine disruptors, if we've been using, cause I think that there's an association between all the toxins we've put on our skin and our thyroid. I mean, I haven't seen research to tease that out, but I know there's a lot of endocrine disruptors there. Thyroid nodules, definitely get an ultrasound, and then work anti-inflammatory, really work on keto alkaline diet. Again, first alkaline, then keto, and decrease inflammation. We really get very insulin sensitive when we do that, and we get a good control of cortisol when we do that. And then that can really benefit you.
Absolutely. And don't forget with that, the leaky gut, the heavy metals, all the things, because it's nodules on the thyroid is usually an autoimmune condition. Even if you don't have the antibodies yet, the thyroid nodules can be autoimmune, and really cleaning up the gut and getting off the gluten and, you know, doing all those things that
getting off grains. Unfortunately, there's a lot of, when we're hit menopause, especially, I mean, I found that, man, my grain limits are very, very low, and I want to embrace that, Rita Marie. But I'm having trouble.
You're having trouble.
But making substitutes, like tabbouleh is a very Middle Eastern. So tabbouleh, I love tabbouleh, but instead of quinoa, I use cauliflower now.
Cauliflower. You know, cauliflower is a great substitute. You make cauliflower rice. We make cauliflower rice pudding.
Cauliflower mashed potatoes.
Cauliflower
right?
mashed potatoes
without the potato.
Here, it's just yes. Yeah, and jicama can be used instead of rice as well. We just did one. We did one of our shows a couple of weeks ago, and we demonstrated the cauliflower rice with coconut, with all that, MCTs and all that. So lots of great things. So you can join. You've got the links to get to the Julva, to get to the quiz. You can join me on my monthly shows that I do, and we internet broadcast them. It's part of a group that people pay to be in, the Vital Health community. But for 72 hours, we put the recordings up and we let you come live. So once a month, usually it's the last Saturday of every month. The next one's July 22nd. And so it's a show. And if you want to share that with your folks, you're welcome to do that. We can give you a link to it.
Yeah, give us a link. Absolutely.
Totally free. And I'm in the kitchen playing. The next one is called Fun with Food. But yeah, we're always doing amazing things, because it's so easy to take these foods that are good for you and make substitutions for the things that are not so good. One of them, we did a cauliflower pizza crust, which was awesome. So
yum.
Yeah, lots of
Well, I want to make an offer to your community too, because you put the Julva link up there.
Yeah.
And put the Julva link up there. And when they get Julva today, we're going to throw in our trial size Julva, which is an extra 7 nights of Julva. So we will throw that into the packaging, the people who order today and till tomorrow morning. Does that sound good?
Super. Yeah.
And so
on a trip with you. Yay.
Yes, absolutely. And you definitely don't want to leave home without it. This is one of those things. Once you start, you do not want to leave this. Went with me to Barcelona for sure. And so you make that order. We'll throw in the 7-night travel size.
Wonderful. And is it something you do twice a day, or you just do it once a day?
Once a day.
Okay, and it's okay to do it at night or in the morning if you're going to have sex night, afterwards is fine, because it's
perfect.
It's not there's
morning
no
or night.
You're not going to hurt your partner.
Not at all. Yeah,
awesome.
Not at all.
Awesome. Well, thank you, everybody. Yay. Keto Alkaline is on her website for sure. Absolutely. And even type into Google Keto Alkaline and she comes up.
And my last name, yeah.
Yeah, and Cabeca. Well, the name of the probiotic you mentioned, I think you said Max something or other.
Probiomax.
Probiomax. There's lots of good probiotics. And come to on Sunday. We're doing. You can put the link there. On Sunday, this weekend we're doing a 2-day live stream. And yeah, we're going to be just throwing lots of stuff on hormone balance, lots of stuff in the kitchen. And one of the things we're going to talk about, we have somebody talking about functional probiotics, like how do you know which probiotics are going to be best for you at what stage in your life. So come to our thing on Saturday and Sunday. And if you don't make it both days, we'll have a recording available for a few days after that. So it's the first time I've ever done it. And it's the first time we're looking at doing this as a paid program in the future, but we decided to do it for free right now just to see what the response was and how good it was. And because, it's really hard for people to travel to go to an event that's 2 or 3 days. And, you've been to my events. It's really fun. But, there's 100 people that can come as opposed to several thousand that can come, or tens of thousands that could come online. And so we want to be able to get this information out and make it easier on everybody and us, because it's easier for me to arrange a live stream event than a live event. So that's at, we'll put the link in. I don't even know what the link is, but put the link in for our thing. Yay. True Self Total Health just shared our video. Yay. Thank you. All right. Thank you, everybody. Thank you so much. It's been such a joy having you here. I'm going to go ahead and stop the live stream. Much love to all of you. We'll talk to you soon. Bye.